Good morning, everybody. I'm Megan Young, Account Executive at H&I Risk Services. I've been working in the transportation industry for over 7 years, and I specialize in only transportation and have 30 clients which range from 20 units to over 1,000. I'm accountable to bring high level of expertise as an insurance advisor, identify opportunities to reduce our clients' organizational risk, and help manage or decrease their total cost of risk. I have been experiencing firsthand some of our clients' wicked problems. One of them is the increasing cost of health care. I'm hoping today that Steve, my co-presenter, and I will be able to increase your curiosity on how to go about putting into place solutions that could fit the needs of your company. Our agenda for today is to talk about the big picture and why wellness is a growing focus. We will also discuss the common challenges in the industry we all love. Next, we will discuss how to move forward with a program that can effectively lead drivers to take ownership of their own health, knowing that there is not a cookie-cutter program out there and that this is sort of a wicked problem you can't just write a check for. We will also talk about how doing something little will set you apart from the other transportation companies, and while their costs continue to go up, you can create a competitive advantage by holding the line. Lastly, we will go over some successful examples of a couple of companies that how they've established wellness programs that are successful for them. Unhealthy employees are more likely to be absent from work. Unhealthy employees are more likely to be less productive while on the job. And unhealthy employees are more likely to be unsafe while on the job. I think we'll all agree with these statements. Doing something about this is what we want to discuss today. But before we go there, what kind of problem is the health of your employees? Around here, we call that a wicked problem. Wicked problems are the kind that keep you up at night and that sneak into your thoughts when we are supposed to be done with work. Wicked problems are the type that you just can't write a check to make them go away. Sometimes they can't even be completely solved. If you are serious about attacking your wicked problems, you can start by changing behaviors. Maybe it's you or maybe it's somebody else, but it likely needs to be both. Every business we've found has a wicked problem. Most have several. Failure to separate wicked problems from wicked symptoms will keep your business from reaching its potential. Motor carriers' wicked problems tend to be, according to the FMCSA, the life expectancy for drivers is 16 years shorter than the national average. Yeah, I said 16 years. More than 80% of carriers report that recent healthcare changes will adversely affect their ability to hire drivers. And I frequently hear this from my clients, that driver recruitment is the #1 issue that they're having. And small carriers are being hit harder with health care increases than larger carriers, 39% versus 24%. Non-transportation companies are seeing high single-digit to low two-digit numbers to give you a little comparison of how you're being affected. According to the IC, 2/3 of carriers are telling them that driver wages must go up above $60,000 to attract and retain drivers. It is likely that drivers will also put more emphasis on shopping for fringe benefits packages as part of the compensation mix in the future, especially as the effects of health care changes reverberate through the economy. These changes will also impact the competitiveness between large carriers and small carriers. As stated before, the life expectancy of drivers is a wicked problem. You can see in this chart the nutrition-related illnesses have the highest death rates. Drivers who have a BMI rate higher than 25% or obese are off work 13 times longer for a workers' compensation claim than an injured driver with a BMI of less than 25%. Also, obese drivers have double the crash rate per mile compared to healthy drivers. I'm going to stop right now and hand this over to Steve to talk about what is driving the healthcare crisis.
Good morning. I'm Steve Hook. I'm the benefits practice leader here at H&I. I've been working in healthcare and employee benefits for about 29 years and here at H&I for the last 2. I thought a quick look at the numbers might put the big picture better into perspective. As of 2009, about half of America was covered by employer-sponsored insurance. The state and federal government was responsible for about 29%. The uninsured accounted for about 17% of the population, which, by the way, was largely the target of much of the healthcare reform enacted in 2010. One of the major contributors to the high cost of medical insurance for employers, as well as individuals, has been the pressure within the healthcare delivery system caused by the government-sponsored programs, both Medicare and Medicaid. The state and federal government control the eligibility for these programs, what the benefits are, how much the taxes are, and how much premiums, if appropriate, for these social programs. They also legislate the rate of payment to the physicians in the hospitals. You often hear in the news whenever the government has been threatening to expand coverage or cut reimbursement rates to the healthcare providers. After all the threats and yelling have stopped, the providers simply raise the rates in the private sector to make up for the inadequate funding coming from the government. Generally speaking, Medicaid pays about 40 cents on the dollar and Medicare about 70 cents on the dollar compared to what employers pay for the exact same services. In today's environment, this process doesn't happen overnight, as most employer-sponsored plans use contracted networks which often have multiple-year contract pricing terms. This graph illustrates the impact over time of the cumulative increases in health insurance premiums and contrasts it with the escalating costs that have been going on to workers' earnings. The gold line shows how workers' contributions have been keeping pace with, or in some years exceeded, the increases in health insurance premiums, the blue line. During the same period of time, both inflation, the gray line, and workers' earnings, the black line, have had only modest increases year over year. The net impact has been a significant decrease in disposable income, leaving less take-home pay for the average worker in America. In addition, during the same time period, most employers have been increasing their plan cost sharing, meaning deductibles, out-of-pockets, and co-payments, making the cost of using the plan even more expensive to the employee, further eroding disposable income for the sick. For many, this has been the perfect storm, making unpaid medical bills the single biggest reason for personal bankruptcy. This slide just moves the same idea from the last slide into a comparison of what the national averages look like in 2000 and 2010. The average transportation firm's numbers typically are higher than these, but here you can see the average family paid $1,619, while the employer paid $4,819 for family coverage in 2000. By 2010, the employee share had increased almost 2.5 times, while the employer share also grew just slightly more than doubled. There are 3 major reasons why healthcare has been growing so much faster than almost every other area of our economy. The broken healthcare system, meaning doctors and hospitals get paid for piecework. The more units of service they can perform, the higher the revenue for their business. There's approximately 250 some odd million people in this country that currently have health coverage, and they've been demanding more and more services. Transparency, or the lack of it. Supply and demand doesn't really work very well in healthcare. This is largely true because of the lack of price transparency. People have not been required to really learn how or know how much of this costs before they actually go and seek out services. Doctors typically don't tell you, nor is it easy to find. Most people don't realize that there's much variation in pricing between one provider and another. And that helps explain why in Milwaukee, You can choose one of 32 different places to have an MRI done of the spine, and the costs range from $211 on the low end to as much as $2,741 for the exact same procedure. A colonoscopy at places like the Milwaukee Endoscopy Center or Columbia St. Mary's or the Menominee Falls Ambulatory Surgical Center cost about $1,890, where if you go to Freighter, Aurora St. Luke's, or Wheaton's All Saints, it's going to cost about $3,342. And lastly, sicker. The population is getting older and sicker. With all the advancements we hear about treatments, new life-saving drugs and the like, the expanding life expectancy of the baby boomer generation, you might be surprised to learn that the high school class of 2010 is the first class that is not expected to live as long as their parents' generation. The U.S. population has been getting sicker and sicker. Employers really can't do that much about the first item. Plan design can help a little bit with the lack of price transparency, but that's a hard road to go. But what I want to do is spend a little more time talking about this last one, about what's driving some of this and what the statistics show about the population getting sicker. To help illustrate the changes in the health status, I want to share with you some incidents of obesity as defined by BMI in the U.S. over time. The first picture in 1994 by state shows the percentage of the population within the state that has a BMI over 30. Between 25 and 30, you're considered overweight. Over 30, you're considered obese. You can see in Wisconsin, the number was in the 14 to 18% range. Only Indiana and Mississippi then were in the next bracket, while all of the Southwest was below 14%. By 2000, no state was below 14%, and many more had moved into the 18 to 22% range, and a large number had moved into the 22 to 26% range. In 2009, over half the states were above 26%. Further, sugar consumption by the average American follows a similar trajectory. In 1900, the average consumption for every American per year was 1 pound. After World War II, that went up to 15 pounds. Then it reached 115 pounds by the mid-80s. By 2000, we tipped the scale at 205 pounds per American. And this problem is even worse in male-dominated professions. Being overweight by itself is not a condition that uses a lot of health care, but it is a health risk that the data shows significantly increases the complexity of treating other conditions and can also lead to actual diseases that do contribute to the escalating cost of health care. Disease that comes from obesity and the future as it stands is frightening. We need to recognize what health care costs are that are sitting in the pipeline. Consider this information. Treating a type 2 diabetic costs about $22,500 versus a healthy worker at about $1,700 per year. Type 2 diabetes, also known as adult onset diabetes, is influenced by poor nutrition, the same cause for most obesity. These maps illustrate the percentage of the entire state population of adults who have been diagnosed with diabetes, can go undiagnosed for long periods. The most prominent symptom is excessive thirst. This symptom is common in both types 1 and type 2 and usually presents also with frequent urination and symptoms. With the increased intake of fluids and foods, there is also high or extreme bouts of fatigue. For type 1 diabetes sufferers, the fatigue can be a warning sign that the need for a shot of insulin. Failure to receive the medication could result in the person entering a dazed state or even passing out. Continued failure to administer appropriate medication could lead to a diabetic coma and possibly death. Blurred vision and slow healing of wounds are also diabetic symptoms. In general, sufferers of type 1 battle with these symptoms for their entire lives. Type 2 sufferers, on the other hand, generally see a slower onset and not always see all of these symptoms. Makes me wonder how many drivers have these symptoms that are unaware of having the disease. As you'll see, in 1994, only one state had reached the 6 to 7.4% range. All the others were below that. In 6 years, only 2 states were still below 4.5%. And by 2009, only 2 states were in what 15 years earlier was the highest category. All the other states had moved past just what a few years earlier was the high water mark. The point for today is that most all the onset of disease was caused by behaviors, choices that are made by the individual. And it's not just diabetes, but most of the claims and the categories listed on this slide, heart disease, cancer, etc., are also largely preventable. This is why so many employers in recent years have been investing more and more energy and resources to helping their employees learn and modify their bad habits with new, healthier habits. I'm going to hand it back over to Megan now to talk some of the common challenges in the transportation industry.
Thanks, Steve. We have officially entered the compliance, safety, accountability era of regulation from the Department of Transportation. With this, we will all see changes in the commercial driver's license standards and driver qualifications. New sleep apnea standards seem imminent, and efforts are underway to standardize training and testing on the federal physical qualifications for those conducting the physical examination. Fitness already dictates standards for blood pressure, diabetes, vision, and so on, but there is increasing emphasis on wellness factors that influence those conditions, such as being overweight. Wellness is not easy. This is largely true because we are talking about behavior change. Bad habits are built over time, and they're going to take time to change back. Some of the common challenges that you as industry professionals see. Communication. Communication on a program can be hard with drivers that you rarely see, but it's not impossible. Many advancements in technology are making it easier to get messages to drivers, and there's also the standard check stuffers and posting in break rooms. The key is grassroots, making this work. Having just one driver to advocate or be your cheerleader will also help get through your driver population audience. Top-level commitment is another challenge. Showing that you care about the driver's well-being by participating in the wellness program helps, but more importantly, it is showing your commitment to make a healthier workforce goes a long way. Things like dedicating company time to focus on wellness, allocating resources and time for your staff to develop programs, and providing the right coverage and incentives will demonstrate your sincere commitment to their well-being. Employees that have a feeling of being valued will be more engaged and perform at their highest level. Some over-the-road drivers do not come into the office for weeks at a time, depending on your situation, and it's difficult to get face time with those drivers, and their routines and hours are all challenging. Sending out messages with little reminders will at least get some thought provoked into the drivers' heads, but finding out how you can help them and then following through has proven successful. Hours and safety. Some drivers do not feel comfortable in their surroundings at truck stops, but suggestions on where others have stopped and had pleasant experiences helps create comfort and promote wellness. It also shows that you care enough to do the research. Schedules, over-the-road drivers or long-haul drivers are allowed to work up to 70 hours in an 8-day period. Once they log in to start the day, they have to stop within 14 hours. During that period, they are allowed to drive a maximum of 11 hours. So by law, we have a minimum of 3 hours to help them use to improve their health. Then they have to take at least a 10-hour break. And smoking is a common challenge. Offering handy tips to stop smoking, as well as factual information on the effects, may promote quitting. But what are you doing to reward those that have quit or have never smoked? The more common challenge is gym access. It's not necessary for a wellness program. Although it may be easier to use, drivers can walk around their trucks, use kettlebells, do a stretching program, all within their trucks. Also, some petrol stops or gas stations have put workout rooms into at least 10 locations along the I-40 and I-95 corridors. Another key note is 34 laps around a big rig is a mile. It may sound silly, but walking around the truck could help, or walking around the perimeter of the truck stop might even be a better idea. Stretching is key to back safety. Participating in a stretching program can help with long hours of being in the cab. It might also help with bouncing back if injuries should occur. Having a professional demonstrate proper stretching during a safety meeting could help drivers see what they should be doing. And it might even be nice to add to your pre-trip inspection routine. You do the pre-trip to maintain your mechanical equipment. Why not include the body? And wingman programs help drivers to keep on track of how they're doing and also create a social commitment to the program. And lack of healthy food options on the road and reduced chance for exercise. The key to this is planning ahead. If you have items readily available, then you don't have to worry about finding a healthy place to eat. Eating is actually getting easier for drivers at some of those truck stops that are producing healthier choices and offering soup and salad bars. It is also much easier today to pack your own healthy food choices. And extreme fatigue, sleep apnea, depression, loneliness, or anxiety. Rested and healthy drivers will help lead to a safer driver. Screenings and preventative measures can identify early and allow for treatment or behavior changes that will lessen the severity or onset of these conditions. Now I'm going to turn it back over to Steve to discuss how to move forward with a program that will lead your drivers to take ownership of their own health.
Thanks, Megan. The point of this slide is really you don't have to figure this all out on your own. The Wellness Council of America has been bringing forward ideas that have been tried and proven successful for many years in the worksite environment. Membership is available to any business. They provide support and ideas that are targeted to worksite wellness. Built on a belief that much of the illness today is preventable and that the worksite is the ideal setting to address improvement opportunities, they are assisting employers adopt new business culture that is changing lives. Historically, employers have kind of resisted getting involved in this area, thinking it really wasn't appropriate for their business to be directing their employees on personal habits. However, the trend has been shifting. Many have come to realize that they have a significant investment in how all this turns out. We are competing in a world economy. We have the most expensive healthcare system in the world, and America has over 70% of the population as obese. And we're competing with countries like Japan, where their population's obesity rates are below 25%. Business is beginning to recognize this is a wicked business problem that neither the government or the healthcare system is likely to resolve anytime soon. Only business can provide the appropriate leadership to really make a difference and influence the behaviors of the workforce. WellCoa's roadmap for worksite wellness is divided into these 7 areas. Companies that have experienced the best results tend to have developed expertise in all of these areas. The first is capturing the senior level support. They're not suggesting that your senior level leadership is the picture of health, but they are suggesting that the policy of do as I say, not as I do, doesn't work in wellness. So you really need to make sure that the senior leadership drinks the Kool-Aid and is supportive of the ideas that whatever wellness activities you bring forward, that they are 100% behind. They also suggest creating a cohesive wellness team. It gets back to, this isn't something that you can just buy from somebody to solve this problem. It really needs to be built at a grassroots level inside your own company. It needs to be branded by your own company. And you need to have champions within your own ranks that bring the message to your employees. They also strongly suggest that you collect data because they firmly believe that you should be measuring the results. And as many have said before, if you can't measure it, you can't manage it. Crafting an operating plan means it's more than just a human resources or a wellness committee agenda. It really needs to be built into the overall business strategy of your company's operations and holding people accountable for their parts. Choosing appropriate interventions means finding out what's most important for your population, not the company down the street or the one on the other side of town. Creating a supportive environment is getting at dedicating some resources, time and energy, things of that sort, that really shows that as a business you really care about the well-being of your employee population. And then carefully evaluating your outcomes. Spending time understanding what worked, what didn't work, rinse that off, build a new plan for the next year and try again. While there are many vendors in the market willing to sell programs, the most effective wellness plans don't come in a box and they aren't provided through a turnkey approach. You simply can't write a check to make this problem go away. I wanted to share with you a recent employer survey in the Milwaukee area on employee benefits. Now, this wasn't specifically about wellness, it was about employee benefits, but it included a key number of questions around their wellness efforts. Of the 74 employers surveyed, 75% of them reported having a formal wellness program, which frankly I was shocked when I saw that. As you can see, the employee participation results are fairly diverse, but a key goal to a successful program is to capture high levels of participation rates. And here we can see that 75% of the employers reported they achieved between 75 and 95% participation of their employees. The last bullet item there indicates that they're not spending a tremendous amount of money in their efforts. Here's some additional data from that survey, and I've illustrated the components being offered, what's being collected, and how employers are evaluating their programs. I just wanted to point out a couple of items here. Under components in a wellness plan, one of the most common components reported is a health risk assessment, which creates the awareness and often can be the first step of doing something different, is understanding what your health risks are. Often when I talk to employees, I'm always shocked, especially if I'm around people who have had a common military experience, because I find out that while they might have been out of the military for the last 25 years, they haven't had a physical since they got out of the military. But the most common component reported here is online health information. And that's something that almost every health plan out on the marketplace today bakes into their current pricing, which is available to all the employees. But oftentimes, many don't know that's there. Under the data collected column, the two most important data elements that are reported are finding out what your employees want by doing an employee interest survey and knowing what the group health risks are, that health risk assessment. And then lastly, when determining how successful your program is, employers are looking at the participation first and then changes in behavior and health risks. I find it interesting to note that only 2% of those surveyed are considering reducing healthcare claims in evaluating their success of their program. Many more of those employers are taking a closer look at their disability and workers' compensation claims in defining success for their program. Another key voice today in the wellness area is Dr. Dee Eddington. He's from the University of Michigan. He's been there pretty much his whole career. In his career, his research, and his work on health risk behaviors and behavior modification has been put into his newest book called Zero Trends. This is a slide from a presentation he recently did about his conclusions that he draws in his book and talking about integrating health into the core of your business. His point and the title of the book suggests that employers can choose the amount of future cost increase they want to experience based on the level of commitment and what he refers to as his 5 pillars of a comprehensive wellness plan. In the center of the slide you can see those 5 pillars. Like Welcoa, Eddington places the first must-have on senior leadership support. But D makes the point that the support needs to include adopting wellness into the culture of business of the company, not just the sponsorship of a wellness plan. It also talks about operations leadership, self-leadership, reward positive actions, and quality assurance. Only the self-leadership is something that's uniquely different to his pillars from what we just talked about from Welcoa. But the point is that by adopting these programs and depending on the commitment that a company has, it will define their health management program, which will then determine the effectiveness on changing lifestyles, making people healthier, a better employee, and then moving over to the right-hand side of that slide talks about all the different gains that he believes that an organization should see from an effective program. I want to spend a little bit more time on that self-leadership idea. The third fundamental pillar in Eddington's model, supporting what he refers to as his health management strategy, is self-leadership. The problem with today's medical model, as he sees it, is that currently we wait for sickness or defect. Then we treat it with pharmaceuticals or a surgical solution. Or possibly we might even detect a high risk, and then we treat that risk with a reduction strategy or case management. And even when you look at preventive services that are being conducted today, most are focused on early detection of something, a disease, a defect. We focus well over 80% of our spending on things that have already happened. He sees that as a failed strategy. Contrasting the self-leadership idea is to move beyond the idea of not being sick or the absence of sickness definition to a high level of wellness and awareness. People have to assume self-leadership for their health, taking a proactive approach to preventing disease and defect, and then companies can provide resources to help them recognize and address risk factors that are purposely discovered, that have accidentally discovered, which will prevent disease or at least presumably discover it much sooner and will be less debilitating. Another key to promoting self-leadership is to create lots of winners inside your population, focusing on keeping the healthy healthy and preventing people from not getting worse. Losing weight might be a difficult challenge for many, but he makes the point, instead of asking your employees to lose weight, what if you actually encourage them by a program that says, well, if you don't gain weight, you're a winner. I'll actually reward you for not gaining weight over time. By stopping the weight gain, which is a natural progression as we age, you'll actually be reducing your future health costs compared to doing nothing. For many businesses, the first look into considering doing a wellness program seems like an unwinnable undertaking. You know, I've attempted to give you a glimpse into some of the ideal state or maybe textbook wellness programs and what they look like based on the learnings of others who have been working in this field for some time. You know, working with our clients, we have found that these things to be important keys in the early stages of adopting a culture of wellness. Begin by creating wellness from the top. It needs to be endorsed and stamped, and while your senior leaders don't have to be picture-perfect examples, they really do need to be your best cheerleader of your program. Use resources that you already have. You probably already have things you're paying for that you may not be using. That's a great way to ramp up into a program, is to advertise and promote those things that you already have. A lot of you already have health risk assessments baked into your programs, but you might not be taking advantage of them. Coordinate with your safety programs. Most of the transportation companies have been working for years at promoting safety. Build on what you've already got, build on what you know works, seems to be a logical place to begin. Integrate your program with other benefits. Make sure that you don't have provisions in your plans that are counterintuitive to what you're trying to promote in your wellness programs. And then encourage a grassroots campaign. It begins small and it grows, like everything else. The companies who have accomplished much have done so over long periods of time. It started with an idea, then somebody had a vision, and then somebody had a first step. Now I'm going to turn it back over to Megan for some examples specific to the transportation industry.
First, I just wanted to share with you about a driver's personal wellness success. Many of you have probably heard of Jeff Clark of Kewanee, Wisconsin, who is both a marathon trucker and a trucker who runs marathons. Several years ago, worried that his sedentary life and his family history of heart disease were putting his health at risk, this motivated him to do something about it. And he read a very bothersome statistic, and this bothers me too. The life expectancy for an over-the-road trucker is 61. With that, he began running. 30 pounds fell off, and in 2009, he was named the Truckers News Health Hero of the Year. Clark, who now tweets and is active in the Facebook group Truckin' Runners, promotes an awareness of these risks for other drivers. The coolest thing about this is that Jeff did this on his own, not part of a program. He took responsibility for himself. And I'm just wondering how many of you have a Jeff-type person working for you. Next, I'm going to get into a couple of examples of a small company, a medium, and a large transportation company's programs. Again, this isn't meant to be cookie cutter, but these are just examples of an successful program. The first program is a company that has about 45 total employees. They have a very motivated senior leader who has supported adopting a wellness culture. And it began with the appointment of a chairperson of a wellness committee. They launched with an incentive-based program in which they put earned dollars onto a health reimbursement account that is coupled with a flexible spending account. The accounts can only be used by employees for health care costs, and each employee can earn up to $250 for the employee or $500 for the employee-spouse combo in a year, simply by doing three things. The first thing is reward for non-smoking for employees and spouses, $75 each with the signed affidavit. The second thing is they complete an appointment for a routine wellness exam with their physician, and they receive $75 each with a signed annual exam certification. And lastly, they maintain their current weight. That gives both the employee and the spouse 2 opportunities to earn extra rewards during the year by not gaining any weight. The weigh-ins are in January, June, and December. And if them or their spouse maintain their weight from January through June, they get $50 each. And if they maintain from June through December, they earn another $50. The dollars can only be used to pay for health care, which helps with the employee's appreciation of the entire benefit plan. And it also gets the employees thinking about their personal wellness throughout the year. And also gets them to visit with their personal physician, who will help hold them personally accountable for their actions. The second example is a medium transportation company. This started about 10 years ago. One of the owners began by putting together a committee of 1 driver, 1 mechanic, and 1 manager, in addition to the owner. To begin, they created these objectives. The plan was not going to use a lot of outside resources. They wanted to have annual employee feedback, and they wanted to keep the program fresh every year. They required all activities to accommodate traveling employees, and today they continue to receive employee feedback from an annual survey. They have created interactive online applications, and they provide wellness incentives up to $500 per employee. And they also have an annual wellness screening and follow-up, including health coaching from a local healthcare clinic that delivers primary care at no cost to the employee or the family. They celebrate their wellness with an annual health fair and company picnic and hold themselves accountable by sharing the aggregate wellness program results with the entire company. And the last example is a large transportation company. They discovered that 10% of their employees used 80% of the dollars spent on health care, workers' compensation, absence, and disability benefits. That group racked up an average of $17,000 per person, compared to less than $500 per person for the rest of the employees. The numbers were even worse when focusing on drivers. 1.4% of high-risk employees were responsible for 40% of total benefit dollars. And after analyzing employee health care data to spot problem areas, the program developed included managing obesity, blood pressure, diagnosing and treating sleep apnea, driver safety, and lunch and learn education programs. They provided enhanced physical exam processes, and they tracked. As a result, a key cost metric went from 22% increases annually to 1.3% decreases. And the company has tracked savings of more than $100 million over several years. So as we've kind of shared today, benefits seen from implementing a program could be decreased health care and workers' compensation costs, greater control over insurance premiums, continuous improvement on safety records, improved employee morale and job satisfaction, and help to attract and retain healthier, safer drivers. As we've said earlier, wellness programs need to have management buy-in in order to be successful, and I'm hoping this presentation has sparked your interest in making a change. H&I can assist you in making any business case to make that change that will lead to solving your wicked business problems. So at this point, we're going to open it up for questions. And in order to do that, at the bottom of your screen, there's a chat feature. And you just click on that and go ahead and put in your question. We'd be happy to answer that. If you have any questions that you would prefer a personal direct response, please include them on the survey that that's going to be popping up at the end of the program, and we will get back to you on a personal level.
Here's a question that actually I've gotten this one quite a few times from folks. How long does it take to see any results from adopting a wellness plan? You know, some companies can see fairly quick results, and others really sometimes have a hard time getting any traction with results. I think in the one slide I showed about the survey, a lot of companies don't even track information. But in any case, I really think it depends on how the program is structured. Both WellCOA and Eddington emphasize the importance of metrics. During the development and design phase of building a wellness strategy, I recommend that you consider defining your success of your program first. Building your program from the results you hope to achieve will help with the rest of the steps in the program. Typically, companies keep semi-annual or annual records of their their wellness activities, and things like participation and satisfaction can have fairly quick results, and you can see those improving from one period to the next, depending on what's been introduced. Documenting things like risk and biometric changes, health risk and biometric changes, can take a couple of years before you see really significant improvement. It largely depends on how much effort, how sincere the employees feel the organization is about helping improving their wellness and the wellness culture. Programs that typically don't gain high levels of participation often only appeal to the already healthy people in a group, and so these kind of programs have a real difficult time showing any improvements.
Here's another question. You stated that doctors' qualifications for DOT physicals are changing. Why and when is this happening? And this date has not been determined as of yet. It was supposed to pass in November and then December, and they keep moving it month to month. So as the date gets closer, look to your H&I representative. I'm sure you're going to be getting something. But for many years, there's been a growing problem with accidents happening due to driver fatigue and other, etc. There will now be the certification program that medical providers will have to pass to be allowed to perform the DOT physicals. And what they're hoping to do with that is that the doctors will be more aware of the industry issues and will prevent a guy going out on the road and having sleep apnea or having a heart problem and driving down the road and killing somebody.
Here's a question about getting senior management support, and how do you convince senior management to adopt a plan? I'd say the first step is to personalize the problem to your senior management. Look at what's been occurring in your own health data, your own plan, your own safety records, and use facts like the 16-year reduction in life expectancy for drivers, or some of the other information that we discussed today. I think it's hard to argue that health is not a serious problem facing most transportation companies. If you're offering medical insurance already as a company-sponsored benefit, you already have a significant business reason to want to mitigate any future risks that have been and will continue to raise your health care costs. Conversely, doing nothing will ensure that you will continue to see pretty high rate increases. We'd be happy to sit down with any of you to help construct a business case for, specific to your organization.
Here's another one. Can you give me some examples of how to integrate safety with wellness? And there's a couple of examples that we talked about during the program was your wellness committee could put in together like a pre-trip to include stretching. You could also include wellness topics during your safety meetings, such as, what your annual physical should include, proper lifting techniques, proper back stretching techniques, nutrition guides. You could create a social society about where safe stops could be, about healthy food options, or great websites to find the best information for these drivers.
This looks like it's probably a common one about drivers that don't care and how do you motivate them to change. Convincing employees that you care about their well-being is a difficult challenge in any industry, probably even harder, much harder in the transportation industry. But I think that's why it's so important to have a grassroots approach, and creating a lot of winners, has been, successful at getting people to start leaning in, and can have an impact on some even the most skeptical of your employees. Building the right incentives and interventions will help build trust and acceptance. Start small, build over time. Ultimately, the goal is to get your employees to accept the responsibility for their own health and embrace an attitude of well-being. Many employers are moving from rewarding activities in wellness programs like a health risk assessment or preventive exams or participating in wellness screenings to a more result-driven model where employees who have obtained ideal wellness metrics like having their BMI in appropriate ranges, blood pressure or cholesterol readings, all within normal ranges, as the key to changing behaviors and showing people and rewarding for the actual results instead of the activities.
I got another question. How can a wellness program attract and retain quality drivers? Well, I would say that programs that effectively communicate the the sincereness that you care about the individual are proven to be most important factors in employee satisfaction and engagement. Incenting non-tobacco users will also attract non-tobacco users. And I didn't know this, but current law allows 20% premium differential for wellness, including non-smoking. And in 2014, that will move up to like 30% and could get up to 50%. And then also, meaningful incentives will be attractive to healthy and fit drivers. So that should make your population a lot more healthy. Okay, with that being said, the rest of the questions, if we get a bunch more, we're going to put together a blog and get that out for you. And like I said before, if you have personal questions, please feel free to put those on your survey that you're going to be getting soon so that we can make sure to answer those for you. And but yeah, if you don't mind, please fill out the survey at the end so that we can make sure that we're giving you opportunities to learn more through our H&IU events. And thank you so much for participating.